Frank! Frank! Hurry! Mr. Bergeron's on. Don't forget the popcorn, Frank.
Coming, dear.
So I guess my kind of word for the wise would be, find out, like when you're shopping before you need something, go call Baypath
Absolutely.
and find out and just have a conversation with them about their services. It may be that you're entitled to something right now that you don't even know about. And remember, don't feel guilty. These are your tax dollars at work. They're not trying to sell you anything. They're using, these are mostly state tax dollars that are designed specifically to help all of you and me and all those other old people that are out there.
Well, there are people who are not so old who are taking advantage of our services as well. And if you have a diagnosis of Alzheimer's disease and you're under 60, you're eligible for our services. But if you were going to start off with the services, I just wanted to talk a little bit about the process of getting the services. You can call us up and explain your situation. The intake and referral specialist would do sort of a very general mini assessment on the telephone, and after that you would be referred to a case manager or an intake specialist who would come out and meet with you and discuss the programs in more detail. It's an intensive process that lasts about 2 hours, where we would go over a variety of typical information that you might find in a doctor's office, like privacy practices. We would go over your income. We do not require any paperwork for your income. It's all verbal. But from that, we would develop a care plan with your guidance. We would work on it together. And at that point, usually, as I said, people get the initial service package of about 3 hours a week of services. If people have critical needs that require more services, there are other avenues for more services to come into your home. And that generally requires an assessment by a Baypath nurse to determine whether you are clinically eligible to live in a nursing home. It doesn't mean that you're going to go into a nursing home. It just means that you're clinically eligible. And that can, from there, depending on your income, we may steer you towards what's called our Enhanced Community Options Program, which would allow us to provide you with a service package of about $740 a month, or about 7 hours a week of services, which can really be a tremendous break for the caregiver, and for the individual involved, because they can get a shower, 4 days a week instead of 2 days a week. And for people whose needs are more critical and whose incomes are low enough to qualify for Mass Health Standard, we can steer them towards the Frail Elder Waiver Program, which enables you to qualify for what's called, I know this is a lot of information, but it enables you to qualify for the Community Choices Program, which is a much more expansive program than either of the other programs. And it can provide you with everything pretty much short of around-the-clock care.
And by the way, we're going to be talking about each of those programs. This is an introductory presentation. As we talk about people with early stage dementia symptoms and later stage dementia symptoms. And the moral of the story, though, is that the state and the federal government are very interested in all of those programs that can keep you home. It seems like, from a distance, all of these folks really want to push you into a nursing home. That is the last thing that any of them want to do. They really want to keep folks at home.
Right. That's pretty much it from my perspective.
And Tai Chi is coming. That's good.
Tai Chi is coming in the fall. And we do have a new website for it. It's Metro West Caregiving, I think, .com. .org, which is great. It's got all kinds of resources on it. And
is that up and running yet? It's up and running very soon.
It's up and running. Yeah.
And it's really terrific because it's designed, they really appreciate the fact that the goal of the exercise is to stay at home, which means the goal of the exercise is to have a whole bunch of people and caregivers talking to each other, right? And really kind of communicating with each other and knowing what this vast array of services is, and that's the point of the website. So
Right.
literally, if you're clicking, you can click Northborough and say, for Northborough, kind of what are the services that are available kind of right here, which is really handy.
Yeah. And
Yeah.
Baypath has its own website, baypath.org, if I didn't say that before, which gives you a full array of our services and contact.
Thank you very
information.
much. And we're going to go back and talk, and once again, we're going to take questions from either of these folks in about 5 minutes. I'm going to give you a very brief piece, though, about why Frank and Mary right now, if they don't have dementia and they've just worried about it in the future, don't have to go give away all their assets and wait 5 years. So remember Frank and Mary, right? And there are their assets. So now, suppose Mary isn't feeling so great and needs nursing home care. How many of you think, show of hands, that they're going to need to really spend down quite a few of their dollars before Mary could qualify for Mass Health or Medicaid in order to have that covered? How many think they're going to have to spend a lot of money? Well, you're all wrong, right? And the reason is fairly straightforward. If Frank and if Mary, I'm just going to go back to these numbers. If Mary needs nursing home care today and needs to qualify for Mass Health, because as we mentioned, Medicare will not pay for extended nursing home stays. They'll only pay for the first 100 days in a nursing home, and only if you're getting better, if you're there to get better, if you had 3 days in a hospital and then go to a nursing home to get better. After that, you're on your own unless you qualify for Mass Health, which is the Massachusetts name for the Medicaid program. But you can qualify if you're Mary as long as you have less than $2,000 in countable assets. Well, of course, they have a lot more than that. But the key is that if you have a spouse at home, Frank can own a house as long as it has an equity of less than $800,000. He can even own a Northborough house. He can own a big house, you know. So he can own a big house. He can have cash or cash equivalent assets, and all of these others are cash or things that can be turned into cash, of up to $117,560. Don't ask me where that number comes from. It comes from the sky.
With Frank and Mary, Eldorado, with Frank and Mary, yeah.
Frank, hurry, Mr. Bergeron's on. Don't forget the popcorn, Frank.
Coming, dear.
It's a regulation. So, but in addition to that, most important, Frank can have infinite income. Infinite income. So, if Mary needed nursing home care, what Frank would do is he would make sure that the house got transferred to him, because remember, he can have a house as long as it has equity of less than $800,000, that all the cash get transferred to him. He's going to keep $117,240, and he's going to use the rest of it to buy an annuity, because he can have infinite income. As long as he purchases an annuity that calls for monthly payments coming back to Frank over a term that is shorter than his life expectancy, and basically an annuity is a contract between somebody and an insurance company, and there are a bunch of them that sell these, right? And the contract is you give the insurance company money, and in return for that, they agree to pay you back that money plus some interest over a term. As long as Frank purchases an annuity calling for monthly payments over a term that is shorter than his life expectancy, the purchase of that annuity is a legitimate conversion from an asset to income. So he can shrink however much money he has down to below $117,240 by buying an annuity. No matter how much those monthly annuity payments are, as long as he makes sure that until Mary has qualified for Mass Health, he keeps his money below $117,240. After that, he can have as much money as he wants. He can hit the lottery. He can get these huge annuity payments and go over that number. So the point is, Frank and Mary, in this situation, do not have to divest themselves of all of their assets ahead of time because they're worried that someday one of them might need nursing home care. What they may want to do, though, is this situation would change dramatically using Frank and Mary's current estate plan, because as we said, their current estate plan is if one of them dies, they want to leave everything to the other one, right? And then when the two of them die, they're going to leave all the money to the kids. Well, if Frank dies and leaves all the money to Mary, and then Mary needs nursing home care, there's a problem, right? Because they've got a lot of money, right? So what would have to happen in that case is that they would have to spend down all of the money, the IRA, the annuity, the joint bank accounts, all down below $2,000. At that point, Mary would qualify for Mass Health because the house is not a countable asset. But at that point, Mass Health would lien the house. If you've heard about this stuff at all, you all know kind of how this part works. Mass Health would lien the house in order to recapture that money after Mary died. So what they would want to do is they'd want to change their wills to say, if I die, I want to make sure everything goes in trust for the benefit of my wife or of my husband. So if Frank dies, everything goes in trust for the benefit of Mary. So we shift all the assets. Remember, Mary goes to the nursing home. We shift all the assets to Frank. And then Frank changes his will to say, when I die, whatever I've got is going to go in trust for Mary's benefit. And he names the death beneficiary of his IRA is going to be his estate because he wants to make sure it funnels all through the will. So it's easy to do all of that. But a key piece of this is the power of attorney. The power of attorney. Because remember, if Mary goes to the nursing home, we got to shift everything to Frank, including the house. But Mary's not capable at that point of signing a deed. She's in the nursing home, or at least perhaps she is not, which means she needs to have somebody who has her power of attorney who, on her behalf, can shift the house and can shift the other assets. So the only really important document is the power of attorney. Some people will shift assets early, but you don't have to. You don't have to. You don't have to go through all of this huge exercise. There were only a few exceptions to this case. If Frank and Mary, in addition to these assets, owned a vacation home, the vacation home would become more problematic because if Mary went to the nursing home, while the system still works, in order for Frank to then qualify Mary, we'd shift the vacation home to Frank also, but then he'd have to go sell it. Well, who wants to do that? Who wants to sell the house on the Cape, or in Martha's Vineyard or whatever, right? So that is the one asset that they may want to shift early and then wait 5 years. Or other large assets, planes, boats, trains, big, huge assets, there may be some other planning. But in the typical case, you don't have to do any of this early. Okay, just two other things. First, if you want to see this again because you thought it was just terrific, or if somebody wants to see it, it's going to be on Northbrook Cable. We don't have the times yet, but it will be on Northbrook Cable. And also, we upload all of these. I have a YouTube channel. We upload all of these shows to my YouTube channel, so you can see it there if you want. Finally, Frank and Mary are going to have their own team this year in the Alzheimer's Walk. There is an annual Alzheimer's Walk. So this is a pitch for the Alzheimer's Association. It's raising money for the Alzheimer's Association. If you're interested in participating, please let us know. We want to have the biggest team walking in Westboro. Frank and Mary will be there, along with a lot of their friends. So we hope you'll be able to come to the next two. You should be getting notices of both of those. There should be one no, I think these are both going to, I can't remember. I think one's in June and one's in September. The next presentation will be, once again, specifically talking about how do you deal with issues in the early stage of Alzheimer's, and then the last one will be dealing with Alzheimer's and dementia while staying home in the late stages. Thank you very, very much, and hopefully we'll see you at another presentation. Thank you.